researcher in the research department at the National Archives. I'm a white woman with short black hair wearing a black jumper. It is a privilege to be here to open the works today. The National Archives holds an extensive collection of material related to the HIV and AIDS epidemic of the 1980s. This includes cabinet papers and records documenting the government response, public health campaigns and scientific research, and records connected with the many intersections between the government and governmental bodies and the spread and effects of the virus. However vast the collection, TNA records tell a limited story of the spread of HIV in the UK. As official documents of the state, they rarely convey anything of the lived experiences and emotions of people who lived or live with or in proximity to the virus. Such histories are often preserved elsewhere by voluntary groups and in community archives. Though they offer different takes on historical facts, both archives and records are necessary and valuable. The idea of the symposium was born from a desire to understand the bigger landscape of these collections and archives, as well as to explore how such collections have been used for historical, creative, and digital research. Over the day, archivists, curators, historians, researchers, and creative practitioners will present their collections and their work to all of us. The two panels in the morning will focus on the collections and will give us a glimpse of what is available in the UK, but there is much more than what we will be presenting today. The National Survey of HIV and AIDS Archives in the United Kingdom, which will be presented today and published early next year, will give space to those who couldn't be invited today. In the first session, we will look at more institutional collections, whereas in the second panel of the morning, at community and crowdsourced archives. We will be back in the afternoon after the lunch break to look at how researchers and practitioners have engaged with these collections. First, we'll hear from historians and then from digital and creative practitioners. I hope you will appreciate the day and the presentations and will follow up with speakers or with us at the National Archives. I will defer to the chairs to provide you with all housekeeping guidance, and I invite you to share your thoughts in the chat throughout the day. Finally, just a reminder that the event will be recorded and it will be available on the National Archives YouTube channel soon. But now, without further ado, let's begin the day.
Hello everyone and welcome to our first panel. My name is Lucy Razzle and I work with Georgia in the research department at the National Archives, and I'll be chairing this panel which looks a little at the landscape of HIV and AIDS collections, showcasing some institutions with significant collections in this area. Our speakers are Chris Olver from West Sussex Records Office and Mark Dunton from the National Archives. Unfortunately, our third speaker, Adam Rose from the Wellcome Collection, is unwell today, so we won't be hearing from him. However, this does give us a little more time to be flexible with our other two speakers and to take some time for questions at the end. So before we start, some brief housekeeping. The session is approximately 1 hour, 15 minutes long, although we may finish a little earlier given that we only have two speakers. It's being run through Zoom webinar, which means you can ask questions by submitting them via the Q&A function at the bottom of your screen. Do submit your questions at any point throughout, and we can come back to them during the Q&A section at the end of the event. My colleagues, TNA admin, will be sharing some guidance about the Q&A function in the chat. And if you need any technical support during the event, please reach out to us via the chat and my colleagues can help you. Please note that this event is being recorded and will be uploaded to YouTube in due course. We've also enabled live captions. You can access these at the bottom of your screen by clicking Live Transcript and then Show Subtitle, or you can hide these if you find them distracting by following the same process. So to introduce our first speaker, Mark Dunton is Principal Records Specialist for Contemporary Records at the National Archives, and he's written and broadcast extensively on the modern period. Mark joined the National Archives in 1983 and has an in-depth knowledge and experience of researching public records, specialising in 20th century Britain, political, social and economic history, in Prime Minister's office records, cabinet papers, and the records of the security service. He has particular interests in Cold War espionage and LGBTQ histories. So without further ado, I will hand over to Mark.
Thank you, Lucy. Yeah. Thank you, Lucy. Okay, so if you just bear with me, I will share my screen. I hope you can all see this presentation. Please let me know if you can't. Good, excellent, thank you. I shall get underway. So thank you, first of all, thank you everyone for being here. I'm going to talk about the official government response to the advent of AIDS using documents held by the National Archives. And I want to convey the sheer richness of our holdings on the subject. And I'll also be using a little bit of documentation from external sources. My particular focus in this talk is on the years 1986 to 87, the period which Virginia Berridge, in her excellent book, AIDS in the UK, Virginia called these the government's wartime emergency years in response to AIDS. But of course, I'm going to set all of this in context. And thinking back to that period, it's important to remember that homosexuality had been partially decriminalized barely 20 years previously in 1967, and the age of consent for gay men had been set at 21. So let's head back to the 1980s. If I can get my slides to move on, that is. Why is this not working? Oh dear. Good. Okay. Problem solved. Okay. Thank you. Sorry about that. Should be all right from now on. So, when did AIDS become an issue in Britain? So, reports of a gay cancer, as it was called, that was affecting American gay men began to appear on television news. I think it was as early as 1980. And I can remember how disturbing and chilling it was to see these news reports. The illness had not acquired the description AIDS yet, but related symptoms included rare forms of pneumonia and unexplained weight loss. This syndrome initially acquired the acronym GRID, Gay-Related Immune Deficiency. The first known case of AIDS in the UK was in 1981. And over the next 2 to 3 years, awareness started to grow and the response within the gay community became more pronounced. particularly after the death of Terence Higgins, a 37-year-old computer programmer in July 1982 at St. Thomas's Hospital. And his death brought his friends together to establish a fundraising organization for research into the illness, initially called the Terry Higgins Trust, which later became the Terence Higgins Trust. Of course, there was a great deal of scientific uncertainty in 1981 to 82 about the causes of this so-called gay cancer. The breakthrough came in 1983 at the Pasteur Institute in France, when it became clear to scientists that a virus was involved in its transmission, and further research conducted by scientists in the US announced in April 1984, which identified the cause of AIDS as a retrovirus and labeled it HTLV-3. It soon became possible to test people for the virus. Well, what had been going on in 1984 into 1985 before the government health campaign came about? Well, there was a lot of research going on at the Department of Health, which was addressing the problem of contaminated blood infected with HIV and hepatitis viruses given to haemophiliacs and people with other bleeding disorders, obviously still a live issue today. And in terms of getting factual information out to gay and bisexual men, elements within the gay community had started to organize themselves. Volunteers started visiting pubs and clubs with leaflets bearing the known facts, but they didn't always get a good reception in the early days. And sometimes the reaction from people in the pubs and clubs was one of disbelief. And that aspect you may remember if you saw the Channel 4 drama series of 2021, It's a Sin. They did have a scene depicting that kind of reaction. The London Lesbian and Gay Switchboard was a leading source of information about HIV and AIDS, and the Terence Higgins Trust opened their helpline in February 1984. The government gave funds to the Terence Higgins Trust in September 1985. The Chief Medical Officer, Sir Donald Aitchison, was instrumental in moving AIDS up the government's agenda in the course of 1985, and the government machine had become galvanized by the issue by early 1986. On the screen are extracts from a briefing for the Home and Social Affairs Subcommittee on AIDS. This is actually from later in the year, November 86, but it reflects government anxiety in a graphic way, with the worry that, cases seem to be doubling every 10 months, and also reflected in that graph. Now, Norman Fowler was Health Secretary, and he was alarmed by increases in AIDS cases. And as he wrote in his book, AIDS, Don't Die of Prejudice, my view was that we needed a direct advertising campaign explaining how the virus was contracted and warning there were no drugs or vaccinations that could be used to counter it. The prospect for those who ignored these warnings was death. The government had to go into some detail about sexual practices and drug taking because drug takers were another group at risk. As Fowler wrote, it was not a time to be delicate. The public needed to understand what AIDS was, how infection occurred, and how to protect yourself from it. So this was prevention through education. Norman Fowler proposed a newspaper advertising campaign in early 1986. Norman Fowler had been Health Secretary since 1981, and although he's on record as stating that when he first knew about AIDS as a serious issue, he knew little about the gay community and had few gay friends, he could not understand why there was opposition to gay people purely on the grounds of their sexual orientation. And he believed passionately that prejudice should not stand in the way of a campaign to prevent HIV and AIDS from spreading. He showed a great deal of drive and determination in this matter, as did the Chief Medical Officer, Sir Donald Aitchison. Of course, the other key player in this story was, of course, the Prime Minister, Margaret Thatcher, who was now well on her way into her second term of office, somewhat buffeted by the Westland affair, but generally maintaining a firm grip on government business and strategy and beginning to contemplate the next election. Now we start getting into the National Archives documents. So what we have here is a memo by David Willits of the Policy Unit addressed to the Prime Minister about AIDS. And I'll just read you the first couple of sentences. Norman Fowler is proposing to place explicit and distasteful advertisements about AIDS in all the Sunday papers. The AIDS problem is now so serious that we must do as he proposes, though his advert could open with more facts about the spread of AIDS. Now, I hope you can see this, but above that first sentence, there's some writing in blue felt tip pen, and this is Margaret Thatcher's own handwriting, her marginalia, as we call it. And she's written here, do we have to have the section on risky sex? I should have thought it could do immense harm if young teenagers were to read it. So Mrs. Thatcher's concern was that the text of the advert would put into the minds of young teenagers sexual practices, particularly anal sex, which they would apparently have never heard of otherwise, encouraging them to experiment with a practice that the government was trying to discourage. And the controversial passage, as it were, was the reference to anal intercourse. And the draft advertisement referred to this as anal, in brackets, back passage intercourse. And the phrasing was fretted around, they were fretting about this phrasing a huge amount. Following Mrs. Thatcher's comments, the phrase was changed to rectal sex. And this is the other part of that memo by David Willits to the Prime Minister. It shows why senior members of the government started to become concerned about the issue at this time, because it seems that they were worried about a spread of the HIV virus to the heterosexual population through drug takers or through prostitution. These are the sorts of mechanism whereby AIDS can spread out to the population at large, warns David Willits. Well, the Home Affairs Committee decided to proceed with the advertisement despite Mrs. Thatcher's concerns, but the Prime Minister continued to battle. She even wondered if the advertisement would fall foul of the Obscene Publications Act. She was assured it would not. You can see her writing again here in blue felt tip pen. I remain against certain parts of this advertisement. I think the anxiety on the part of parents and many teenagers who would never be in danger from AIDS exceeds the good it would do. It would be better, in my view, to follow the wartime VD precedent of putting notices in surgeries, public lavatories, etc. On this last point, Norman Fowler wrote in his book, as for the Prime Minister's idea of confining messages to public lavatories and surgeries, there was no evidence that in the late 1980s, with all the modern communication techniques at our disposal, that this was remotely the best we could do. The world had moved on. I'll come back to that point about Second World War campaign about venereal disease. Norman Fowler's response to Mrs. Thatcher's concerns was really pretty robust, stressing the urgency of the matter. But he made the following amendment to the text, which I think I've mentioned perhaps already. Rectal sex involves the highest risk and should be avoided. And Thatcher then gave the go-ahead, and the adverts appeared in the press in March and April 1986. So this is part of the newspaper advertisement published in the press on the 17th of March. And note that under what is risky sex, in the third column, the phrasing is shown there that was agreed. Rectal sex involves the highest risk and should be avoided. Hardly any complaints were received about these advertisements. In June, Fowler made it clear to Willie Whitelaw, who was the Lord President of the Council and who became a central figure in this whole business. Fowler made it clear he wanted a new round of advertising to maintain the momentum, but drawing on evidence from surveys of public opinion, he wanted to use shorter text and simpler language. This time, Mr. Fowler insisted the phrase anal sex should be used as rectal sex was insufficiently understood, and he got his way. Norman Fowler kept up the tempo with the campaign. In August, he proposed that a leaflet be delivered to every household in the country, spelling out in simple and explicit language what they needed to know about AIDS. And this was Mrs. Thatcher's first reaction to this proposal. Why universal delivery of AIDS leaflet, but nothing about drugs? My first reaction is against the idea, but await other comments. Mrs. Thatcher clearly felt at this time more emphasis should be put on countering the spread of HIV infection through drug use, through contaminated shared needles. Nicholas Edwards, the Secretary of State for Wales, also had misgivings about the danger of offence, that if you put material through people's doors, you give them no choice but to receive it. And he was worried about the possible exposure of children to this information. Lord Hailsham also had major doubts about the leaflet drop and expressed concern it would cause controversy, offence, and might well spread panic. The H Committee was split on the matter, and again, Mrs. Thatcher expressed concern about the various risks attached to this proposal. Norman Fowler reflected, as I was taught in my army days, if you come up against an immovable object, try to go around it. His team at the health department came up with the idea of a special AIDS cabinet committee that would be well equipped to make speedy decisions. There was a problem. Such a committee was likely to be chaired by the Prime Minister. But then the Cabinet Secretary, Sir Robert Armstrong, took a lead and persuaded the Prime Minister that her deputy, Willie Whitelaw, would be best placed to chair the committee. And Whitelaw was, in Fowler's words, an inspired choice. He had had oversight of sexual health services for the army forces in Cairo at one stage during the Second World War, and his approach was pragmatic, and the committee was soon making good progress. During the last quarter of 1986, the media were getting increasingly interested in the subject of AIDS, and advisors to the Prime Minister started to impart advice to her, which implied that she needed to shift her position about the leaflet and the campaign in general. Her chief press officer, Bernard Ingham, wrote this memo to David Willits on the 29th of October. And I'll just quote, "There is certainly a feeling abroad that the government is doing too little and is not treating the issue with sufficient urgency. There is also a feeling that the Prime Minister is acting as a brake on educational publicity." I think it's really interesting that Bernard Ingham wrote that memo because, he was very, very loyal to the Prime Minister, but even he was feeling uneasy about the lack of progress. David Willits took on board Bernard Ingham's comments, and he made a highly persuasive case to the Prime Minister for agreeing to the leaflet. And one of the points he made was, there's not been a single complaint about obscenity in the newspaper adverts earlier this summer. And he also states here that the leaflet may be backed by TV advertisements. More on that shortly. Mrs. Thatcher agreed to the leaflet drop to go ahead, which it did in January 1987. And this is the leaflet that was delivered to every household in the UK. One of the I'm going to come on to the television adverts in a moment, but in terms of new proposals from Norman Fowler, the next one was that on the 30th of December, Fowler proposed that he should deliver a ministerial broadcast about AIDS in January. So, okay, but the Prime Minister refused. And you can see her comments in the left-hand margin here. And it reads, I am against it. A leaflet drop to every house is to explain the reason why. To take the first ministerial broadcast for 8 years would, in my view, be wrong. Fowler visited Number 10 on New Year's Eve to discuss the matter further with the Prime Minister over a whisky in her study, but her mind was made up. According to Fowler's account, referring to a ministerial broadcast, she says she has not had one on the Falklands, on the riots, or on any other health issue. Fowler writes that the Prime Minister did see AIDS as a very serious health threat, but he goes on to write that at one point she said to him, you mustn't become known as just the Minister for AIDS, Norman. Fowler simply felt he had a duty to warn the public of the dangers. I've had the privilege of interviewing Lord Fowler, sat at our facsimile cabinet table here at the National Archives, and he told me that Mrs. Thatcher did not really have her heart in this campaign. There's a video of that available, of that interview on the National Archives YouTube channel, by the way. Earlier, I drew attention to David Willett's comment that the leaflet campaign may be backed by TV adverts, and indeed it was. And anyone of a certain age who lived through the 1980s will remember these TV adverts, particularly the one with the tombstone known as AIDS Monolith. And this, from our files, is the storyboard for the AIDS TV advert by advertising agency TBWA. Now, with this advertisement, the actor John Hurt did the voiceover for the chilling tombstone advert. And of course, John Hurt, if you think about it, he was in the first Alien film of 1979, and his strong association with that role is another factor at play. Here is something new, terrifying, and alien. And there was another advert which was particularly shown in cinemas as well, which was called Iceberg. And you see the camera panning over an iceberg and then going underwater, showing the extent of the iceberg under the water, with the implication that, it's just the tip of the iceberg in terms of people who may be infected and who don't realize it. And there's a sort of a logo of AIDS under the water. It's all very chilling, and there's a feeling of nuclear winter about these advertisements. Almost they are apocalyptic in their tone. Now, some people were critical of the adverts because of the lack of detailed advice within them, and some people may have thought such was the level of fear that these advertisements engendered, that this might have added to the stigmatizing of the gay community, despite the message that, as they said on these adverts, anyone can get it, male or female, gay or straight. But the thinking was, we only have 40 seconds. We need to make an impact, something that will make people stop in their tracks. reflect and pay attention to the "Don't Die of Ignorance" leaflet, which is being put through every household's door. And in those terms, I think it was highly successful. Norman Fowler said to me that the advertisements had to be forceful in order to punch the message through for the public to take notice. So it was a blunt instrument that they used, which may appear unfeeling to some people, but we need to understand the context. And remember, the means of communication were limited compared with today. It was a pre-digital era. No mobile phones, of course, 4 TV channels. So, the channels of communication were limited. And remember, there was no effective medical treatment for AIDS at this time. However, by early 1987, the Department of Health was developing a new strategy. They wanted to change the emphasis of the AIDS campaign and to begin to target the at-risk groups, including gay men and business travelers, for example. And around February 1987, an advertising agency was presenting to the Department of Health mock-ups of adverts which were intended to target gay men specifically using the gay press. And this is an example from one of our files. These adverts were never used, and the whole notion of targeting gay men in this way was shelved by the government, and nothing happened on this particular front until the Health Education Authority ran some adverts in the gay press in 1989. Well, why was this campaign shelved? Just very quickly, there were several reasons. The proposed campaign material was pre-tested using a survey of gay men, and it was found to be ineffective in encouraging safer sex behavior. The HEA reportedly came to the conclusion that much of the material may antagonize many gay men by suggesting promiscuity is the norm among them. Some officials realized that such a campaign could be criticized as homophobic or condescending, and I certainly think there's a condescending tone to this mock-up advert on the screen. It was also realized that not all gay men were on the scene. Only a certain percentage read the gay press. Some ministers were opposed to this idea. They would have had qualms about the content. Some DHS officials were also very cautious in their outlook. Some gay organizations and spokespeople lobbying the government didn't want a government campaign targeting gay men because they felt it could have the effect of stigmatizing the gay community. So it was a highly sensitive issue. In any case, there was a danger of duplicating work that was already being done very effectively by organizations such as the Terence Higgins Trust. And then the other factor was Section 28 or Clause 28 of the Local Government Bill, which became law in 1988. This stated that a local authority, quote, shall not intentionally promote homosexuality or publish material with the intention of promoting homosexuality. And this had an inhibiting effect, leading to a great deal of self-censorship amongst groups connected with local authorities. I realize I need to speed up a bit, but I am moving towards the end. Okay.
Thank you, Mark. Yeah, just
Yep.
to say, can we wrap up by 10:40 so that Chris has plenty of time?
Yes, I'll do my best.
That's 1 to 2 more minutes.
Okay.
Sorry, Mark, and thank you.
Yeah. Okay. Was the public education campaign as a whole effective? I think it's a fair claim to say yes, it was. In the Gallup report of 1987, well over 90% of the public had seen the advertising. The TV adverts made a deep impression. Knowledge about AIDS increased dramatically. Condom use increased. There was a marked decrease in sexually transmitted disease amongst gay men, and as I understand it, in the heterosexual population as well. The prospect that AIDS would spread into the general population did not materialize. Did the government overreact in 1986, 87? Well, it's a matter for debate. Of course, hindsight is a wonderful thing. Terence Higgins Trust noted that France, Spain, and Italy were slower to react to the threat of AIDS than the UK, and the level of infection of HIV in those countries was considerably worse in comparison. We should remember the work of charities and activists who played a significant part in the fight against AIDS. Gay men did change their behavior around sex. Friends had started dying So, what more salutary reminder could there be about the need to adopt safe sex practices? Yeah, I know need to finish. I'll be very quick, I promise. Uh, Not many people know that in August 1989, Mrs. Thatcher actually visited the Mildmay Mission Hospital in the East End of London, the first AIDS hospice in London, and met a couple of dying AIDS patients. And she did actually give a donation to that mission. There was no publicity for this at the time. Norman Fowler said, he tried to be fair about Mrs. Thatcher. He said she may have grumbled, but with the exception of the cancelled ministerial broadcast, she did not veto our efforts. There again, I think he pointed out there was no mention of the AIDS crisis in her memoirs. As you know, AIDS faded as a strong national issue after 1986 to 87. There were various reasons for this, but time is against me, so I'll wind up. World AIDS Day keeps the whole issue in the public eye. I will wind up there. Sorry, I overran. My apologies. Okay. I will stop sharing.
Thank you so much, Mark. I'm sure people will have appreciated that really detailed introduction to some of the materials held at the National Archives. So thank you very much.
That's okay. I just need to stop share. Yeah.
And if you, yes, if you could turn your camera and audio off as well.
Yeah.
Thank you, Mark. So I'm delighted to welcome our second speaker, Chris Olver. Chris Olver is an archivist who's been working on the National Survey of HIV and AIDS archives at the West Sussex Record Office, based in Chichester. The survey has been running since January 2023, and the report is due to be released later this month, I believe. He's previously catalogued the National HIV Story Trust Oral History Collection at the London Archives and HIV and AIDS archive collections at the London School of Hygiene and Tropical Medicine. So welcome, Chris, and do share your screen.
Yeah, first off, you can hear me, right?
I can hear you.
That's
Yes.
good. Okay. Yep, perfect. Okay. I am just going to find my presentation, which is on my browser. There we go. Brilliant. Thank you for inviting me to this symposium. It's a real privilege to be here, and after spending 2 years surveying HIV records, it's fantastic that the National Archive have brought this symposium together for World AIDS Day. In 1990, the archivist Janet Foster published a report on the survey to find archives relating to HIV and AIDS. The survey was part of the AIDS Social History Programme, which ran at the London School of Hygiene and Tropical Medicine from 1988 to 1994. The aim of the survey was to locate relevant personal and organisational papers within the HIV arena and illustrate the archive potential for contemporary history of AIDS. The publication highlighted 28 archive collections representing the statutory and voluntary sectors, health education and service provision, charities and self-help groups, drug agencies and medical research, hospices and industry. Of the 28 archive collections that were identified, 13 of these have since been deposited in archive repositories, and a further 4 of these have some material in archives. 10 of these collections, however, have had no material deposited, and the whereabouts of the collections remain unknown. Many of these collections which were not deposited came from the voluntary sector. and include national and large regional charities such as Immunity, National AIDS Helpline, and the Scottish AIDS Monitor. Janet Foster identified voluntary records as the most at risk as there was no existing safety net, and stated that those in the sector realized that they need advice and guidance in record keeping, selection, and preservation. The Documenting HIV Epidemic, a survey of HIV and AIDS archives in the United Kingdom, is a continuation of the earlier survey. This project's stated aims were to undertake a survey of HIV archival records in public and private hands and identify collections which were at risk. Unlike the AIDS Social History Programme, which created a documentary archive, this project's aim was not to collect material, but to assist and advise private collections and, where requested, find homes for these collections. In my talk today, I will present some of the key findings of the survey results of archive collections currently in the UK. I will also share some of the case studies of the collections that I surveyed and some recommendations on how these collections can be preserved for future generations. The National Survey of HIV Archives was created because of the concern that important archive collections relating to the history of HIV were in danger of being lost. The West Sussex Records Office, based in Chichester, launched a 2-year project in January 2023 to survey HIV records in public and private hands. The project is funded by the Annabelle Foundation, who first expressed a need for a survey after depositing their own papers for the HIV charity Avert at the West Sussex Record Office in 2021. The main aim of the project was to identify vulnerable collections and help safeguard them through a provision of professional archival advice for long-term preservation of these collections, and bring together information about HIV records across the country into a resource which would help guide researchers to find them, provide information about how to access them. The end product of the survey is to create a report based on the work due to be published online in January 2025, almost December, but I've asked for an additional week, including an accessible version of the survey's collected data. The project was conducted over 4 interlinked phases, with the initial phase of surveying HIV and AIDS records in archive repositories conducted between January and June 2023. Information about collections was found using a combination of searching through online catalogues, historical literature, and online resources, as well as being reported by archive services directly through a circulated questionnaire and email correspondence. The survey was shared through the archive sector, through the archive NRA mailing list, and through specialist archive repository groups, such as the Charity Archives and Records Managers Group, CHARM, and Archives for Wales. This was by far the easiest part of the project, thanks to the availability and profundity of online data, especially those held on the National Archive website, where databases such as Find an Archive, the accessions registers, and the discovery database were particularly useful in locating HIV and AIDS collections. The second phase of surveying private archives built on the previous survey work by targeting individuals and organizations that were not present in archive holdings, and following contacts and suggestions of private collections from archive contacts. This phase of the project was extended to run most of the duration of the project due to the time needed to build up a network of contacts to find collections and have time to survey them. This was one of the most challenging phases of the project, as it required patience and occasional detective work to find contact details. For an example, I managed to find an imminent retired HIV consultant by finding his contact details listed on a regional choral music festival website. Mainly, contacts were found though through a series of introductions on my behalf from people in the HIV sector, with an interest in the project. Without this support, it is unlikely that the survey would have covered as many private archives as possible, and I'm extremely grateful for the support I received throughout the project. The third phase involved conducting a series of on-site inspections of collections to evaluate any risks to these collections and to assess their historical value. Over the course of the project, I conducted 20 site visits across England, from Newcastle to Devon, and sometimes over multiple days and visits. Most of the visits were in private homes, but also included offices or hospital storage units in underground car parks. Well, one. Of the 20 collections that I surveyed for this project, 8 of which have since been connected to archive services to discuss future deposits of their collection. The site surveys were by far the most rewarding element of the survey, and I'm very pleased that my visits were mutually beneficial in providing help and advice about collections, and hopefully no one was put off by my limited appetite for cakes and biscuits, where I am very much an outlier in this profession. Okay, that is the last joke, I'm sure. Sorry. The survey found that there is in terms of the key findings of the survey found that there is relatively abundant HIV records in some subject areas and localities found in the UK archive repositories. The records overall showed a broad spectrum of material types, including personal papers, organisational papers, clinical records, oral histories, printed ephemera, and audiovisual and digital records, majority of which was catalogued in some degree and publicly accessible. Those identified in public archives are likely to represent only part of the overall holdings, with many other relevant records in larger non-HIV specific collections, such as health or local government papers. But they do not show up on catalogue searches as they have not been catalogued to sufficient granularity. The survey received a very good level of participation from the archive sector, with 140 organisations directly contributing information about their holdings. This was also seen within HIV organisations with a response rate of 38%, which is twice as high as responses from previous remote record surveys of private archives. Individuals approached the project were also happy to help, though some did not have their own collections, with several people reporting that they had got rid of their archives in this previous decades, either through house moves or just thinking no one was interested in their records. In total, the survey accounted for 2,270 catalogue descriptions of HIV records held within 120 heritage organisations, of which 272 of these were of a higher level archive description, e.g. series level or above. In addition to this, 124 records were identified as likely to hold relevant material about the HIV epidemic, but could not be confirmed as they were either not catalogued or indexed to a level where the information was easily obtainable. There were several archive repositories that had extensive HIV collections and continue to collect HIV material to the present day, namely the Lothian Health Board Archives based at the University of Edinburgh, Bishopsgate Institute in London, and the Wellcome Collection. These are not necessarily the largest collections in terms of physical quantity, with the National Record offices such as the UK National Archive having vast holdings, as Mark has recently discussed. But they do reflect that these institutions often have more proactive collections policies in taking in new collections, especially relating to HIV and AIDS. Most of the records, both in public and private hands in London or southeast of England, most of the records were found in public and private hands were from London or southeast England. These findings mirrored historic and current case numbers, but also were where most HIV organisations and services were based. Regions with relatively low levels of archive records included Northern Ireland and the northeast and northwest of England. Some of this is likely to have been because relatively few records were created, but this is not the case for northwest of England, where primarily the records which were recorded were of a higher level, say collections level, and actually it was a discrepancy, unfortunately, in the collections sampling size. Yes. Feel free to ask me a question about that at the end if you'd like. Many of the surveyed materials, particularly related to the AIDS crisis of the 1980s and 1990s, were where most records relating to the official government and medical responses of the epidemic. There was a significant amount of collected material relating to the community response to HIV and AIDS, primarily from the LGBTQ+ community. Other demographic groups were less represented, such as the Black and Asian communities, trans communities, and women, while surprisingly other historically affected communities like IV for drug users and people living with blood disorders also had fewer records than anticipated. Subject areas where there were relatively low number of records included business, law, insurance, and pharmaceutical records. The latter is perhaps having the most long-term research value, considering that several UK-based companies were involved in antiretroviral drug production, including GlaxoSmithKline, ViiV Healthcare, and US companies based here, such as Gilead Science. The main risks of collections reported by private depositors was organizational closure or changes in living arrangements. For the most part, the physical conditions of collections was good, but items often required appropriate repackaging, and in some cases, digitization, such as with audiovisual material. Digital material, whether on external media or servers, was the most at-risk material reported, with several people reporting data loss, corrupt files, and no longer having access to records due to not having the necessary media or software to open the record. Oh, my bad. To understand whether these private collections were at risk, it was necessary to conduct on-site inspections of these collections to answer crucial questions regarding what condition the collection was in, how material was stored, if there were any imminent risks associated with the collections. In the final survey report, I have drawn up case studies of some of these site surveys and present some examples here. One of the first surveys that I conducted for the project was to visit the Staffordshire Potteries, also known as Stoke-on-Trent, to meet Maurice Greenham. I met Maurice at the launch of the National HIV Story Trust oral history collection in February 2023, and he mentioned that he had a private archive relating to the Staffordshire Buddies, the HIV organisation set up in the county to support people living with HIV in the 1990s. I was intrigued, especially as I knew that there were not many records that existed of the buddy system, where trained volunteers provided emotional and practical support for people living with HIV, which operated by many HIV charities in the 80s and 90s, and so arranged to see him in September 2023. Over the course of 2 days, I surveyed his archives, which combined his own personal papers relating to his own HIV diagnosis and maintaining his own health, and his long-term involvement in HIV organisations supporting and advocating for people living with HIV. This included a great deal of organisational records relating to the Staffordshire bodies, many of which were unique, as the charity that preceded it, the Staffordshire Sexual Health Charity, had lost its paper archive during a previous office move. Through Morris, I also connected with Andrew Colclough, the former director of Staffordshire Bodies, and with the current charity. Morris has continued to take in and document related material from other friends and acquaintances, including the logbooks of the Staffordshire Switchboard, LGBT switchboard. He is a great example of an activist archivist, and through his own collecting and initiative, he has managed to help preserve the history and experience of HIV and AIDS in the local area, which otherwise would likely to have been lost. The archive of JAT, formerly the Jewish AIDS Trust, are a good example of a trend in smaller charities that no longer have a physical premises. The charity was identified as an organisation would be good to contact, but I could not find an up-to-date email for the charity online, and at the time of the survey, it did not have a functioning website. Fortunately, a member of my advisory group knew one of the trustees and put me in touch, and as it so happened, they had some archive material and were based nearby in Brighton. JAT was set up in 1988 by a group of Jewish people living in North London to raise awareness of HIV and AIDS and support and advise people living with HIV and AIDS in the Jewish community. Since the charity is formed, it has branched out to provide HIV and AIDS awareness and safer sex education to schools and youth groups. When the government funding stopped in the 2010s, the charity could no longer maintain an office or pay for a full-time member of staff, and reduce their activities. The institutional records that they decided to keep when the office closed was divided up amongst the trustees. It was through Ruth Hilton, chair of the JAT trustees, who allowed me to survey the collection at her home in Brighton. The archive is significant because it is the only organisation of its kind to help and support people living with HIV in the Jewish community, and also to tailor sexual education to Jewish schools. While the physical archive was in good condition, the main risks associated with the collection were its digital assets, some of which dated back over 20 years and which were showing signs of degradation. The last case study, which I'd like to share with you, is of a private collection that I have known the longest. I first came across the HIV graphic communication website in 2013 when I was cataloguing HIV records at the London School of Hygiene and Tropical Medicine. Sian Cook, who created and curates the site, had set up the website that year and had digitized examples of the printed HIV public health material that she had collected from the early 1990s. The site was created to be a historic visual archive of promotional campaigns and graphic ephemera, compiled in order to examine changes in health promotion approaches, messages, and concerns about HIV and AIDS in the UK and the Republic of Ireland. Since launching the website, she has expanded it to contain thousands of images of ephemera categorized by various subjects and targeted audiences. I visited Sian in February 2023 and spent an afternoon looking through the thoroughly well-organized boxes and drawers of physical ephemera that she had collected over the years. While some of the printed ephemera, like the UK government Don't Die of Ignorance leaflet, is commonplace as it was delivered to each UK resident's home in 1987, other ephemera can be very rare and possibly unique, as hundreds of small grassroots organisations were set up from 1980s onwards. The HIV Graphic Communication Archive has examples of literature from HIV voluntary groups in Cornwall, or an extremely rare HIV awareness leaflet targeting heterosexual men, or even a commemorative T-shirt for the Meals on Wheels charity food chain, which was contained in a disposable takeaway container, of which I probably should have included a picture, and I don't know why now. There are no current plans to deposit the physical archive, with Sian stating that she would find it difficult to find an appropriate place to donate to an archive in the UK, as it would need to be accessible. The archive model that she preferred was the Interference Archive in New York, which is a public access archive which allows users to come in and access their OpenStack archive collections themselves and use the material freely for their projects. While I am unaware of such an archive model existing currently in the UK, I have noticed some community archives show a similar attitude towards accessibility. The Queer Norfolk collection held at the Norfolk Heritage Centre in Norwich held material from multiple local HIV organisations and which was accessible to any member of the public without making an advance booking. Sian is not alone in sharing this sentiment with other HIV activists sharing similar thoughts, where the engagement with the history is prioritised over the areas of collections management such as long-term preservation and security. In terms of recommendations for improving long-term preservation of the history of HIV and AIDS in the UK, I would recommend establishing a clear and visible pathway for people with relevant records to follow to be able to report potential collections which are at risk. This project has shown that there is a need for this, with several collectors requesting urgent help with their collection. This could take the form of an email group service like Groups.io and members of the forum, which could come from academia, heritage, and the HIV sector to provide a broad range of opinions and support. Additional resources for preservation and the management of archive collections could also be made available for private collectors, along with signposting to useful networks and other online resources. Secondly, echoing the recommendations of Janet Foster's 1990 report, raising awareness of the importance of record keeping in HIV organisations to ensure that records of long-term interest are identified and measures are put in place to store the records on site safely or in an archive repository. This is specifically the case with digital records, including websites and emails, where the awareness of digital preservation, principles that these websites could be of archival value is currently lacking. It is also important to raise awareness of the significance of HIV history in the archive and heritage sector, especially in regions where there are limited records. While there is a clear collecting interest in some of the larger archive services in London, this is not as developed in other parts of the country. Even when reported cases of HIV in a region are low, this does not mean there are no relevant records. Recent projects such as the Isle of Wight Out on the Island project has collected oral history testimonies of people living with HIV on the island. Whilst in West Sussex, I have found evidence of various HIV voluntary organisations across the county, including a hospice set up for people living with, for people with HIV near the town of Petworth in the 80s and 90s. Effort is also needed to be made to increase representation of marginalised groups impacted by HIV in archives, such as from the African diaspora, the transgender community, prisoners, sex workers, and migrant groups. More efforts needed to be done to connect with these groups and build partnerships to show that these histories matter and it is reflected within our National Archive repositories. As these histories are potentially the most at risk of being lost, as they are not widely known, it would be potentially beneficial to prioritise cataloguing grants or fund additional record surveys in these communities to find potential records in private hands. Improving access to existing public records relating to HIV and AIDS should also be pursued. While most of the archive records which are deposited by private donors have been catalogued and made accessible, this is less of the case with records transferred from government and health institutions. Typical records lack any detailed cataloguing, making it hard to locate relevant records. Improving the level of cataloguing of official government and health records or creating specific finding aids like research guides. This is what the Sheffield City Archives did earlier this year, with their own HIV holdings, which brought together all the relevant archive collections, local history resources, and newspaper cuttings into one online resource. Thank you for listening to my presentation today. To find out more about the project, please visit the West Sussex Records Office website, where the final report is due to be published in the early 2025. Thank you.
Thank you so much, Chris. That was really, really interesting to hear about this important survey work that you've been doing. And I'm sure a lot of people attending today will be really looking forward to reading that final report in due course. So thank you. We have a few spare minutes. So I will take a couple of questions from the Q&A on Zoom, if that's okay for Mark to join us again.
Yeah. Hi.
Hi, Mark.
Hi.
So I will pick a question from the chat, and if you could maybe both take a few moments to respond if you're happy to.
Sure.
So a question, you mentioned the lack of records from London hospitals, which played a key role in the early response. Can you say more about this gap? Does it relate to the situation on NHS records more generally?
Did I mention that?
I think
I don't
Chris
recall.
did.
Oh, Chris did. Okay.
Would you like to go first, Chris?
Yes. I think it is one of those things which is genuine, generally and specific to HIV, because it's very similar to some of the results which were coming out of the infected blood inquiry in terms of what is happening with, you know, the transference of NHS records to places of deposit. I think one of the things I would say specifically is I tried to find more material from some of the big London teaching hospitals, but I was really surprised that, say, St. Mary's Hospital had no archives, despite having a dedicated archive service. There was no HIV collection there. Barts, of course, does have some really glorious material, but of the other London teaching hospitals, there's really quite few amounts of material. So I did visit Chelsea and Westminster during my survey, and they unfortunately don't, the material that they have has been transferred to the London Archive, and unfortunately it only constitutes at the moment one box of material. And considering how, you know, the Cobler Centre is, you know, pretty much the biggest HIV outreach centre in the UK, if not Europe, it's quite shocking in a way. But I think this is systematic of dealing with or with medical records in general, where I think there is a reluctance because of patient confidentiality and data sensitivity to really engage with, say, you know, to make those records potentially available for historical reasons after their period of after their retention period. I think that, and I think this is where it's just more of a sense of kind of communication with people who are the current record controllers, to show that there is actually an interest in these records. But yeah, I'll stop talking to allow Mark to say something.
No, that's okay. I can't really actually add all that much more to what Chris has just said, really. I mean, I've looked at quite a lot of files here, but in the files I've looked at have been very much on the political response to AIDS and the publicity in that sort of 1986-87 onwards period. So I haven't really done wider research than that, you know, across a wider spectrum of records. But I think all the points that Chris has just made are good. I will reflect on it. I'm going to reflect on it, consider. But I think all the points that you've just made, Chris, are very valid. Yeah. When I get a chance, I'll try and discuss it with colleagues here. Yeah. Yeah.
Thank you both. We are at time, but I'll take one more question just because we started a little bit late. And I wonder if you could both comment on one kind of intersectional history that's present or not in these records, and that is the intersection between HIV, AIDS, and disability within government policies and community experiences.
Okay, well, I'll go first, but I believe in being honest, you know, about things. And if I simply, it's not an angle I've researched. As I say, my research, though I've looked at lots of files, it's been really on political and the initial kind of publicity phase. I haven't encountered any particular material concerning disability in relation, you know, in conjunction with AIDS. I haven't. I don't know if, you know, I have another colleague who, you know, other colleagues who may have encountered that material. I mean, we're still discovering material, actually, particularly going into the 1990s and beyond. And some of it's really quite rich in terms of publicity. So sorry to give a rather vague, waffling answer. I'm really sorry. It's just, it's not something I've encountered in the records particularly. I can only assume that it might feature, you know, in later records, maybe records that are not even transferred to us yet, because, you know, I would imagine that the initial response probably would not have really taken it much on board from the government, sadly, you know. But yeah, Chris, I don't know if you got any views on this.
I think that possibly there is going to be things on HIV and disability, because people living who had an AIDS diagnosis in the 80s were basically they were classified as disabled. So they were, I don't know the specific government acts, but it's essentially they became part, they were given they had a particular disability grading, which essentially allowed them to have access to sort of like social service support to have so to make their houses more, you know, various things like that. So that definitely was something which was, I think, quite significant in the 80s and 90s. In terms of actual archive material, I am similar to you, Mark. I haven't really come across any directly, but I would say that there are some very good oral history testimonies especially with, say, the National HIV Story Trust, where HIV and disability are talked about. And I think that at least is one place I would say is look at oral histories, and especially I know there are a few people as well who are people living with HIV and have disability who would be able to really elucidate on that history. But I do think that is a very good avenue of looking at HIV. So thank you very much for bringing it up.
Thank you. And I see from our Q&A that one of our speakers this afternoon will be talking about AIDS and disability a bit this afternoon. So if people are staying for the rest of the day, there's maybe a chance to consider that in a bit more detail. So thank you, George. In the interests of keeping to time and giving people a screen break, we'll now take a 10-minute break until 11:30. and then we'll return for our second panel on community archives later this morning. Thank you very much to both of our speakers, to Mark and to Chris, for brilliant papers which have got the day off to a great start, and we look forward to hearing from our next speakers in 10 minutes or so. Thank you, everybody.
Thank you.
Thank you.
Hello. Can we?
Hi.